9 common causes of snoring. Snoring occurs when air cannot flow freely through the airway during breathing in and out while asleep. If the airway is narrowed or partially blocked, breathing causes the tissues in the upper airway to vibrate, producing the sound heard when someone snores. There are many potential reasons why a person might have a chronically narrowed or blocked airway during sleep that leads to snoring. 1. Obstructive sleep apnea, OSA. Not everyone who snores has obstructive sleep apnea, but most people with OSA do snore. OSA is a common sleep-related breathing disorder that often goes undiagnosed. It is characterized by repeated pauses in breathing during sleep due to the partial or complete collapse of the airway. People with sleep apnea often snore loudly with periods of silence when breathing stops. When they resume breathing, it can sound like gasping or snorting. OSA is linked to adverse health outcomes such as depression, high blood pressure, and heart disease. Daytime sleepiness can also lead to accidents while driving or at work. Fortunately, OSA treatment can successfully alleviate symptoms and reduce the risk of harmful health effects. Treatments include the use of continuous positive airway pressure, CPAP devices, lifestyle changes, dental devices, and surgery. 2. Alcohol and sedative medications. Alcohol and other sedatives can cause snoring by relaxing the muscles that support the tissue around the airway. Therefore, chronic snorers, including those with OSA, who consume alcohol may experience more severe snoring. Doctors often recommend avoiding alcohol and sedative medications in the hours leading up to bedtime to lessen snoring. Although this snoring management approach has not been evaluated in a randomized clinical trial, some individuals may benefit from it. 3. Smoking. Smoking is another risk factor for snoring. It is not entirely clear why smokers are more likely to snore, but it may be due to inflammation and edema in the upper airway caused by smoking. Quitting smoking has been shown to improve snoring. Although it can take time, studies have shown that snoring rates remain elevated in people who have recently quit, but decline within 4 years to match those of non-smokers. Forehead and neck anatomy. The size and shape of certain structures can constrict the airway and lead to snoring. For example, people are more likely to snore if they have a deviated septum, where the wall between the nostrils is bent or skewed to one side. Additionally, growths in the nasal passages, such as polyps, having a small jaw, and having an enlarged tongue or tonsils, can contribute to snoring. Treatment options for those with these anatomical causes include surgery and dental devices, which aim to increase airflow in and out of the airway during sleep. These methods have proven effective for some patients with OSA, but further research is needed to determine their effectiveness in individuals who snore but do not have OSA. 5. Chronic nasal congestion. Having a stuffy nose during sleep can lead to snoring by reducing airflow through the airway and causing it to collapse. Allergies or infections are common causes of nasal congestion, but other factors such as being in a dry air environment or having a deviated septum can also contribute. If these conditions persist, nasal congestion can become chronic and lead to habitual snoring. A study of middle-aged adults found that those who experience nasal congestion at night always or almost always were 3 times more likely to be habitual snorers. Treatments for snoring due to chronic congestion depend on the cause but may include nasal decongestants or nasal steroids. 6. Sleep position. Snoring is more frequent when lying on your back, also known as the supine position. When lying on your back, gravity pulls the tissue surrounding the airway downward, narrowing it. Research has shown that the frequency and intensity of snoring decrease for some when lying on their side, known as the lateral position. Various approaches to positional therapy, which encourages sleepers to avoid lying on their backs, include positional alarms, modified night shirts, and lateral sleep pillows. Data also suggests that using a special pillow designed to keep the head to the side can decrease snoring. 7. Being overweight. Excess tissue in the neck can lead to a smaller airway size and increase susceptibility to airway collapse. Weight loss may improve snoring in overweight individuals. A study found that men who lost at least 6 pounds saw reductions in their snoring frequency, with greater weight loss associated with nearly eliminating snoring. Chapter 8. Aging. Older age is associated with various sleep changes, including increased snoring. The tongue and muscles surrounding the airway may weaken with age. Engaging in mouth and throat exercises, also known as myofunctional therapy, can reduce snoring caused by weak muscles. A review of studies found that myofunctional therapy reduced snoring intensity and frequency. 9. Hypothyroidism. Hypothyroidism is a condition where the thyroid gland is underactive and does not produce enough thyroid hormone. Untreated, it leads to symptoms such as a puffy face, hoarse voice, slow speech, and slow heart rate, and can also contribute to snoring. Research involving sleep studies on 20 patients with hypothyroidism found that all of them snored. Treatment for hypothyroidism involves taking medication to replace the thyroid hormone deficiency.